Hello, dear doctors. Here we are going to talk about another question. A 72-year-old man is found not breathing in the CCU with the following rhythm. His pulse cannot be felt. What is the single most likely diagnosis? This is the patient's ECG. A. Supraventricular tachycardia. B. Ventricular tachycardia. C. Ventricular fibrillation. D. Atrial fibrillation. And E. Atrial flutter. According to the patient history, which is not breathing and he has not detectable pulse, and as we can see clearly in the patient's ECG, it can be ventricular fibrillation. And here we are going to explain why it's ventricular fibrillation. Okay, ventricular fibrillation means sudden death. The blood pressure drops immediately to zero, and so does the cardiac output. Ventricular fibrillation is the most important shockwave cardiac arrest rhythm. The ventricles suddenly attempt to contract at rates of 500 beats per minute. This rapid and irregular electrical activity renders the ventricles unable to contract in a synchronized manner, resulting in immediate loss of cardiac outputs. Unless advanced life support is rapidly instituted, this rhythm is invariably fatal. Prolonged ventricular fibrillation results in decreasing waveform amplitude from initial course VF to fine VF, and ultimately moving on to asystole due to progressive depletion of myocardial energy stores. ECG findings for ventricular fibrillation. Chaotic irregular deflections of varying amplitude, as we can see clearly here. We can see chaos here, irregular deflections, completely irregular deflections with different types of amplitudes. No identifiable P waves, QRS complexes, or T waves. There is no any identifiable P, QRS, or T waves, as we can see in this ECG clearly. We cannot say which one is P, which one is QRS, and which one is T wave. The rate is between 150 to 500 per minute. Also, in ventricular fibrillation, counting the patient's rate is difficult, as we can see in this ECG, but it can be between 150 to 500 per minute. There is no specific pattern to the discharge, as we can see here. There are different types of wavering baseline patterns. There are different types of wavering baseline pattern. Thus, there is no any specific pattern for discharge. And there is one important note. Ventricular fibrillation requires immediate treatment with advanced cardiac life support, including defibrillation. Without treatment, VF can be fatal within minutes. We must point this note. It's very important. Thank you for your attention.